What's up, YouTube? I'm Mike, and today I received my latest shipment of testosterone replacement therapy from Royal Men's Medical Center. So I was going to do an unboxing, but first, let me just explain a couple of things. One, your shipment comes via FedEx, or at least mine always do, and you're supposed to have someone at your home to physically receive the package. They don't have to sign for it, I don't think, but they have to receive it, at least until COVID happened. Now they kind of just pitch it at my door and take off. But used to, there had to be someone there. It didn't have to be an adult, it could be one of your kids. But that I tried to get that fixed. Like, I tried to talk to the FedEx people to get that changed because my wife and I both work, and it's a total pain to try to have someone at your house to pick up the package. So I guess it's one benefit of COVID. Now they just drop it at the door and ring the doorbell. So let me show you a little bit what the box looks like. It comes in, mine comes from Hollandale Pharmacy. That's the compounding pharmacy that makes the products. I think it depends on where you live in the country. I'm in Texas, Hollandale's in Florida. I've actually had one package come from a pharmacy in Austin, Texas, but they changed that for some reason. So it comes in this box, and then on the inside you have an inventory that's got a list of all the products you're receiving. Obviously, I covered all of my personal information, but this kit was supposed to be different. I asked them to stop mixing the anastrozole and the testosterone together. I wanted to just take pills for reasons that I'll probably explain in another video. And they sent the right number of anastrozole pills, but as you can see, one of the boxes you get has the testosterone cypionate in it, and my bottle came. You get this testosterone cypionate with anastrozole infusion. So I've already sent them an email to find out why they did that, because now I have twice as much anastrozole as I need. So your testosterone will come either in a 10 milliliter bottle that looks like this, or two 5 milliliter bottles. I've received it both ways. Depending on the way your body reacts, when you first start in the program, you get 200 milligrams per milliliter of test cypionate with 1 milligram of anastrozole infused. 3 weeks into the program, I started developing gyno, and so they added an extra half milligram in pill form of the Arimidex or anastrozole. So because I have to take extra, I get a bottle that looks like this. It's got the prescription label on the other side. It says anastrozole, tells you when to take it. They're 1 milligram pills, so you have to cut them with a pill cutter, because typically, for me, the dose is half a milligram on the day that I take my gonadorelin. So you get that. You get the syringes. So you've got one package that's got the syringe barrels, and it comes preloaded with the mixing syringe. It has 20 gauge, 1.5 inch needles. They're very large. I'll show you one of the needles. The reason for this, I explained in my other video, is because the oil is very thick, and so you need a large gauge needle to get the oil out. You can try to use the 25 gauge needles that they give you in a separate little Ziploc. These are designed for injecting. You can pull your shot down with one of these needles, but it takes a while. It drips out pretty slow. So it's quicker if you use the drawing syringe, and then what you do is you just unscrew that needle, and then you screw on one of the 25 gauges if that's the way you use the product. I explained in my other video, I no longer do that. You get one large mixing syringe. The reason for the mixing syringe is that your HCG, what used to be HCG, now gonadorelin, has to be reconstituted. So you get a little box that looks like this. Inside is another vial. That vial has a powder in it. I'll make sure I don't drop this. It's got a white powder inside the vial. And so, I don't know if can you see that? So you have to pop this plastic piece off. Inside the box is a bottle of bacteriostatic water, which is just sterile water. So you use this big syringe to drop 10 milliliters of this, squirt it into this, and then you've reconstituted the what's now gonadorelin. Again, I explained all this in my other video. I'll put a card up above so that you can watch that video. They give you 2 packages of insulin pens. These are 30 gauge 5/16 insulin pens. These pens are used for injecting the gonadorelin. That is injected subcutaneously, so you just get a little pinch of fat and you go right under the skin. The bigger 1.5-inch needle, 25 gauge needles are for the intramuscular injection, which typically goes in the glutes or the quads. Excuse me. I don't do those at all anymore. I use a insulin pen and I hit one of my delts typically, or my pecs or my lats. So this is what the kit looks like. You get one kit every 8 weeks. It's designed to give you 8 doses, and it's nice because, as you can see, it all comes prepackaged. Everything has a prescription label on it, so you don't have to worry if somebody thinks you're taking steroids. You can prove that you're actually on TRT, and it makes it nice and easy to keep up with everything. You don't have to worry about sourcing your own syringes or needles. The only thing that's not included that I would definitely recommend that you get is alcohol wipes. Luckily, things have gotten better on the COVID landscape, and you can get alcohol wipes again. Whenever you use the product, you want to swab the top of the bottle. Each of the bottles, swab the bottle with an alcohol wipe and swab, obviously, the skin wherever you're going to inject to make sure there's no bacteria. You don't want to get an abscess or an infection. So yeah, if you go the Royal Men's Medical Center route or another company that sends the meds to your door, this is what you can expect, which in my opinion is way better than having to drive to a clinic, set an appointment, drive to a clinic, have the doctor give you your injection, and then go about your day. So again, I do 2 injections a week instead of one on Saturday morning and one on Tuesday night. And my wife, who is playing camera woman, is usually the person that helps me with those shots. So as always, if you have any questions about this program, TRT in general, you can leave a comment in the section below. Thumb up this video if you enjoyed it. Comments help the algorithm. And I'll see you on the next one.